Thank you, Tyler. A big change for women's health. Most women, now this is according to the National Institutes of Health, that's 80% of black women, 70% of white women have uterine fibroids. But there's a new way to treat them, so let's talk about it. With us this afternoon is Dr. Jan Katsnelson, CEO and founder of USA Fibroid Centers and Fibroid Fighters Foundation. Thank you so much for being with us.
Good afternoon, dear.
A lot of men don't know it, but women sit around complaining about the pain of fibroids sometimes. That's a common thing. What are fibroids?
Fibroids are the benign tumors that grow inside the uterus. Can be 1, can be 20. They do not kill, but they ruin their lives.
And what are the signs and the symptoms that a woman might have fibroids?
There are two typical groups of symptoms, one related to bleeding and another to pressure. Bleeding is prolonged heavy menstrual period that can last 1 or 2 or 3 weeks. Bleeding in between menstrual period, anemia, and the pressure, it's pressing on other organs around because they can be as big as a grapefruit and can be many of them. It's like small bladder, constipation, seems like a baby bump or pain during the sex.
So you want to get rid of them.
That's the idea. And one of the terrible symptoms that sometimes women find the disease is spontaneous miscarriages, losing the baby. Very, very common problem.
Now, I have a video that you provided of a uterus, a simulated uterus, and fibroids and how you can treat them. As you explained to us about the uterine fibroid embolization, let's take a look at that video. So how can you go in and get rid of the fibroids?
So uterine fibroid embolization, it's no surgery. It's a procedure that we do in the office, and we have dozens of offices in almost 30 states. And what we do through the needle hole in the wrist, we send the catheter to the origin of the blood vessel that feeds those fibroids, and we turn the faucet, like stop watering the lawn and it will die. The same thing will happen with fibroids. They will die, shrink, and get absorbed by the body. That's the catheter. It goes all the way up towards the origin. It's done under very light sedation, and women can go home 1 or 2 hours after the procedure. Procedure is about 30 to 60 minutes. 1 or 2 hours later, women can go home, and 3 or 4 days later, they will go back to normal life. Typically, after procedure, women can experience cramps, like a heavy menstrual cramps, and that's about it. And what's important to know, after fibroid embolization, women can have babies.
Wow.
So please, no need for hysterectomies. All the hundreds of thousands of hysterectomies need to be prevented, should not happen, because hysterectomy can have problems and complications as well.
Now tell us, where can a woman go and just do some reading, try to make a decision on whether that is the procedure that she needs? Where do you recommend she go?
USAFibroidCenters.com. USAFibroidCenters.com. We want to make sure that women say no to hysterectomy, no to suffering, and explore options. And for hysterectomy, it needs to know that uterus doesn't have only function to grow babies. It also holds everything in the belly from falling down, and it also participates in contraction in orgasm. So removing hysterectomy, removing of uterus, can lead to prolapse, incontinence, sex life is not the same, drug addiction, and other things. Do not take lightly removal of organ from the body for benign reason. Look for UFE, which is minimal invasive, outpatient, fertility-friendly option. USAFibroidCenters.com.
Wonderful conversation. Thank you for that information this afternoon.
Thank you very much. Thank you.
Our pleasure. Well, still ahead,